Good afternoon. My name is Adrienne Gray. This video is to teach about transmission-based precautions, and at the end of the video, the student will be able to recognize the differences between standard, contact, droplet, and airborne precautions when asked by an instructor in accordance with CDC guidelines. As healthcare providers, we work with environments that are conducive to moving illness from one patient to another. One way that healthcare institutions use this is through transmission-based precautions. 4 levels of precautions exist, which are standard, droplet, contact, and airborne. In the picture, the man is handling a child with gloves on because he is working inside of his mouth and exposed to his saliva. This is an example of standard precautions. Standard precautions are what should be used on all patients and includes hand washing and using PPE when there is an expectation of exposure to infectious materials. Dirty linen should be handled away from the body. Patient care areas should be disinfected regularly. Sharps need to be disposed of safely. These are the basic ways to keep our patients and ourselves well. Contact precautions build upon standard precautions and take it to the next level. These are used when there is a suspected or known infection of an organism which is resistant to multiple antibiotics such as MRSA, VRE, or Pseudomonas. In these cases, after entering the room, gown and gloves are applied as a barrier against coming in contact with the infection. If needed, other forms of PPE can be used when there is a potential for splashing, such as mask or goggles. Patients under contact precautions should have their movement limited to prevent the spread of disease and should be housed in patient rooms by themselves or cohort with another patient that has the same illness. Droplet precautions continue to build on the layers of the previous 2 precautions. Droplet precautions are used to protect against infections such as meningitis or MRSA of the sputum, which is carried on droplets no further than 3 feet from the patient when a patient coughs or sneezes. Nurses who are caring for these patients should be dressed in an isolation gown, surgical mask, eye shield, and gloves. If a patient with droplet precautions needs to be moved outside of the room, then the patient should also have a surgical mask in place. When the patient care is finished, these items are removed while still inside the room, hands washed, and then the nurse can continue on their duties. Airborne precautions are the final and most severe precautions on the list. Airborne precautions are used when the patient has an illness, such as tuberculosis, which is strong enough to survive in the air without having a vector such as droplet or contact diseases. Patients in these precautions need to be placed in a negative isolation room with their movement outside of the room strictly controlled. If they need to leave the room for medical purposes, they must wear a surgical mask. Medical professionals need to wear everything on the list in the droplet category, but the mask is changed to an N95 mask or higher, which is fit tested prior to patient care. Dressing into and out of PPE for airborne precautions occurs in an antechamber just outside of the actual patient room. By observing the signs and using proper precautions for these patients, we can keep ourselves and the rest of our vulnerable patients safe from infectious disease.